Hi friends, it's time for our Ask the Doctor segment with Dr. Hanna Merchant. Hi Dr. Hanna, thank you so much for being here again.
Thank you for having me, Valerie. It's nice to be here again.
You know, mental health is such an important topic for women. And we've got a great question that came in from one of our viewers who asked, can mental health impact physical health? And what are some signs that we should be looking for?
Oh, mental health can absolutely affect physical health. Chronic stress levels have been shown to suppress immune function, raise blood pressure, and actually increase the risk of heart disease. So it's something that's really important for women to know and understand about. So we normally think about mental health, we start off talking about depression and anxiety. Depression can cause weight gain, it can cause weight loss, fatigue. You can have little interest in doing things that you previously wanted to do. And anxiety, you can have a fast heart rate, you can feel panicked. It can feel like a panic attack. Anxiety can cause a rapid heart rate, chest pain, shortness of breath. Also, a lot of these symptoms can show up as GI. So a lot of times, you have abdominal pain or maybe some nausea, vomiting, and IBS type symptoms, irritable bowel syndrome. You can also have persistent pain. You can have headaches. And a lot of times we ignore these kind of symptoms, especially as women. We just ignore them.
Right.
And think, oh, it'll go away, or oh, I need more sleep, or I need something else.
Absolutely.
But the key thing is that if you notice a change in what you're already doing or what you're already experiencing, that's when you should consult a health professional and really look into these symptoms.
All of those symptoms you're mentioning, I can check off all of my boxes. Now, how do I know when I need to see someone?
Well, how new are these symptoms? Are these symptoms you've been having for a very long time? Are they interfering with your home life, with your work life? Are you able to do your job? If you're not, or if you're just noticing that these things are different, those are reasons to see your primary care physician.
What if some of those symptoms subsides? Like you said, as women, we think, oh, it's going to pass, I can manage it. What if I've learned to manage some of these symptoms and they're no longer there?
Well, if the symptoms are no longer there, you may not need to see someone, but it really depends on how much it's affecting your life. If you feel that, the issues with sleeping or your irritability or your ability to do your job, interact with your family, if you feel like these things are suffering, that's a reason to see someone and just talk about the symptoms you're having rather than ignoring them, which is what we often do as women.
Right.
So one thing we really need to make sure that we don't do is self-medicate. A lot of times people use smoking, alcohol, physical inactivity to treat their own symptoms, but that's not the way to do it. It really is to see someone, see what kind of help you need, and get that help. The help is out there. It's just a matter of asking for it, knowing that you want to make a change.
Right.
Remember that poor mental health can result in neglecting self-care. As women, we're already taking care of everybody else. We need to take care of ourselves as well. How can we take care of everyone else if we're neglecting ourselves?
Right.
So we need to remind our viewers that it's important to seek medical help when you're really struggling and you need just that little extra something.
Thank you so much. Always great information. Always nice to have you. So friends, if you're having any new symptoms or are concerned with anything about your health, please go see your primary care physician. If you have a question for our expert, head to our website, fashionsensehawaii.com. We'll be right back. Tune in for your daily dose of fashion sense on Spectrum OC16.